Hello everyone, in today's video we are diving into the fascinating topic of biomarkers. By the end of this video, you will understand what biomarkers are, why they are important in health and nutrition, and see some interesting examples of how they are used. To kick things off, let's talk about what biomarkers really are. Think of them as tiny clues our body gives us about what's going on inside. When we hear the term biomarker, it refers to anything we can measure in our body that tells us something about our health status. This could be anything from a molecule in our blood to a gene in our DNA. Now, why do we need biomarkers? Well, they help us go beyond what people report or feel, giving us real objective data. So instead of relying on someone to remember what they exactly ate last week, we can look at their blood or tissue for signs of nutrients, disease risk, or even exposure to certain environmental factors. This makes biomarkers incredibly powerful tools in understanding health and nutrition on a deeper level. Before we classify biomarkers, let's understand what are the characteristics of an ideal biomarker. First thing is reliable. It means that it should be consistent and accurate and give accurate result every time it's measured. Next is safety and easy to measure. The process of measuring it should not pose risk and should be straightforward. Then it is sensitive and specific. This means that it should accurately detect specific condition or changes in health with minimal chance of error. Then we have can be applied to diagnosis, staging, prognosis. This means that it should be versatile enough to help in diagnosing a condition, determining its severity or stage, and predicting outcomes or progression. Next, we have cost efficiency for follow-up. It means that it should be affordable, and if there is long-time monitoring, then people should be able to afford it. Then we have modification with treatment. This means that the biomarker should respond to treatment, meaning its level should change in a way that reflects the effectiveness of an intervention. Overall, these characteristics help ensure that the biomarker is useful in medical practice, providing reliable information that support healthcare decisions. Now, let's understand the classification of biomarkers. Biomarkers are classified into genetic biomarkers and biochemical biomarkers. Firstly, we have genetic biomarkers. This focuses on our gene. Our DNA holds a lot of information about how our body processes nutrients, responds to certain food, or even what health risks we might inherit. For example, some people have specific genetic markers that affect how well their bodies handle cholesterol or absorb vitamins like folate. With genetic biomarkers, we get a snapshot of someone's unique health profile and potential risk factor. Examples include single nucleotide polymorphisms that impact cholesterol metabolism or folate absorption. Now, let's understand biochemical biomarkers. Biochemical biomarkers, on the other hand, are all about what's happening right now in the body. They are often measured in blood, urine, or other tissue and can show levels of nutrients like calcium or iron or markers for disease risk like cholesterol. This type of biomarkers is more about current status, kind of like a health checkup that can tell us if we are getting enough of the nutrients we need or if there are areas of concern. So, genetic biomarkers help us understand our unique biological makeup, while biochemical biomarkers give us insight into our current health and nutrition status. Together, they can help guide personalized nutrition and healthcare. Now, let's dive into some examples to make this idea of biomarkers more concrete. First, we have red blood cell count. Red blood cells carry oxygen from our lungs to the rest of the body. If our RBC count is low, it usually means there is lack of oxygen transport, often due to anemia. This can point to deficiency in nutrients like iron or vitamin B12, which are essential for red blood cell. Next, we have folate. Folate is really important for DNA synthesis and cell repair. Measuring folate level can tell us if a person is at risk for condition like anemia, or in a pregnant woman if there is a risk for neural tube defects in the baby. Low folate can happen due to poor diet or certain genetic factors that make absorption difficult. Next, we have calcium levels. Calcium isn't just for bones. It's also crucial for muscle and nerves. By measuring calcium level in the blood, we can assess bone health and detect conditions like osteoporosis. If calcium levels are low, it may indicate a need for dietary adjustment or even health concern that affect calcium absorption. Now let's look at LDL receptors in cardiovascular disease. You might have heard about LDL, often called as bad cholesterol. LDL receptors are like little gatekeepers that help clear LDL from bloodstream. If someone does not have enough of these receptors or they are not functioning well, LDL level can rise, increasing the risk of heart disease. Checking LDL receptor function helps us understand someone's cardiovascular health and guide necessary lifestyle changes. Now we have vitamin A. Vitamin A is essential for our immune system, vision, and skin health. Blood retinol levels tell us if someone's vitamin A level are where they should be. Low levels can lead to problems like night blindness, especially in regions where vitamin A deficiency is common. Each of these biomarkers give unique insight that help assess nutritional status and guide health recommendation. This is why they are so useful in both clinical settings and nutritional research. I hope everybody understood. Now, to wrap things up, biomarkers are essential for anyone interested in understanding health from the inside out. They allow us to go beyond guesswork and get precise information about our health, nutrition, and risk factor for disease. By measuring biomarkers, scientists and healthcare professionals can make more informed decisions, creating personalized plans that address individual needs and promote long-term health. Thank you for tuning in. I hope this helped you understand the world of biomarkers a bit better. Have a good day.